Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a primary care, weight management, and aesthetic medicine practice located on Long Island in New York.
Good afternoon, and I'm Irina Berger, co-founder of Northeast Medical Practice and also administrative director. Dr. Berger, today I'd like to talk about the medication, weight management medication. A lot of times patients asking, as soon as I get up, does it mean I'm going to stay forever on those type of medication, or if I change my lifestyle, I'll be able to come out and pretty much, come off the medication?
Yes, it's a common question and an important one, of course. So I want to preface everything by saying that obesity is considered a chronic disease. We've thought of it that way since 2013, when the American Medical Association gave it that designation. So regardless of whether we're using lifestyle by itself or lifestyle plus medicine, we have to think about this as a long-term endeavor. And just like blood pressure, if we get someone's blood pressure under control with medicine, we're unlikely to be able to take them off it unless they make significant lifestyle changes. So there's some new studies out that are really interesting with regard to this and in terms of how we might be able to get people off medicines for weight loss. In particular, I'm referring to semaglutide, which is Ozempic for diabetes, Wegovy just for weight loss, as well as tirzepatide, which is Mounjaro for diabetes, and Zepbound for weight loss. So there's a new study out with semaglutide that showed basically there might be some benefit to tapering as opposed to cutting off the medicine cold turkey. So what was done over the course of a little more than a year, patients were on semaglutide and at the maximum dose they could tolerate, basically. And on average, they lost about 15% weight loss. After that period of time, about 64 weeks or so, they tapered them off the medicine over a 9-week period and then saw what happened 26 weeks later. So about half the patients actually continued to lose a little bit of weight, about 2% or so body weight loss. But and the other half started to gain around 1% or so, and they went back on the medication. Now, I probably should have mentioned that all of these patients were involved in a very intensive lifestyle modification program with nutrition counseling, exercise, physiology, or a fitness program, and also mental health providers. And that was maintained throughout the study, so that could definitely be a big part of the reason why there wasn't a lot of weight gain, or at least half the patients didn't seem to gain much weight back or lost a little. We can contrast that, although with a different medication, and with the SURMOUNT-4 trial, where Zepbound was used, and we looked at weight gain after stopping, or the authors did, after stopping the medication. So in that trial, for half a year, the entire group of patients was on maximum dose Zepbound. They lost about 20% body weight on average. And then for the remainder of the year, they were, half the group continued on that dose of the medication, the other half, unbeknownst to them, went onto placebo. And what happened at the end of the year was that the patients who received medication the whole time, they lost about 25% body weight on average. The other half on placebo during the second half of the year, they only lost about 10%. So they regained / never had the opportunity to lose another 15% of their body weight. But this was a cold turkey stopping after 26 weeks. Now, there was lifestyle modification being done with the patients in the program, in the study as well, but it's always a little difficult to compare the lifestyle changes that are done in any particular study with another study, and compliance with those changes can often be varied and variable, so it gets a little bit tough to compare. But this study, the first one with semaglutide, perhaps there's going to be some benefit to tapering over a 9-10 week kind of period. That's how I like to do things, and so it gives me some optimism for that kind of methodology. But by the same token, small study, They only watched them for 26 weeks. Half the people did need to go back on medicine, but it shows some promise. But regardless, patients have to bear in mind that this is a long-term endeavor, that you need to have very intensive lifestyle changes in place throughout the whole time you're on the medicine. If you're going, you should, just in general, for your overall health, but also if you want to think about being able to taper off the medicine or taper to a lower dose after you reach your goal weight.
So patients often say whenever they start weight loss medication, it suppresses appetite. So when you start taking medication, your appetite comes back?
It typically does, yes. And that's because of some hormonal issues involved with appetite and satiety. So leptin, a hormone that controls your appetite, it should go up when you gain weight to control weight. Once you get to a certain weight, people tend to have resistance to it. And that tends to last even for a couple of years after weight loss. However, ghrelin, the hunger hormone, always goes up whenever you lose weight. And so you have this almost irresistible endocrine urge driving you to eat. So yes, it can be very challenging for patients, and this is the reason for that weight gain. Plus, every time you lose weight, if you go through a yo-yo kind of cycle, each time your resting metabolic rate never comes back to the level that it was the other time. So this is a reason why we really want to avoid yo-yoing, as people call it, because it's going to get harder to lose the weight each time you go through one of those cycles.
You mean if you lost for the first time and then you regained and then to lose it again the second time, it becomes more challenging?
That's right.
Okay.
Yeah. So that means if we do start to decrease the dose of medicine for weight loss, that we want to watch the patient closely and make sure they're not starting to regain. If they are, we want to catch it quickly and maybe go back to the prior dose.
So if somebody lost already weight and they're in optimal weight, and I know you're taking BMI and you're constantly monitoring patients, what do you do? You mentioned that you're decreasing the dose, you pretty much
Right. I want
providing the maintenance?
I want to try to do that with each patient. Less medicine, the better, if we can. But I need to watch their weight and their body composition with the bioimpedance device we have very closely to make sure that we're not starting to head in the wrong direction again, and catch it early
Before it goes up.
so we don't go through one of those cycles. Yeah.
Thank you, Dr. Berger. That was very, very informative.
Thank you. So, if you'd like to learn more, please reach out to our office. We're Northeast Medical Practice, 516-604-3418, or find us on the web at northeastmedicalpractice.com. Bear in mind, as always, that the information we provide on these videos is for educational purposes only and should not be considered medical advice. Please reach out to your medical provider with any questions or issues that you have. We look forward to seeing you next time. Until then, be in good health.
Thank you.